Welcome to Politics Done Right. I am your host, Egberto Willies. This is the progressive program that will take the mystery out of politics. This is the program that will encourage you to make sure government becomes we the people. Whether you are liberal, conservative, or otherwise, you get to air your point of view. Remember, you can also send me a tweet to EGBERTOWILLIES, that is, at Egberto Willies. Let us engage. It is politics done right.
1, 2, 3, 4.
Hello, folks. Welcome to one more edition of Politics Done Right. I'm Egberto Willies, your host. Thank you so kindly for being here with me. Today, we're going to discuss something that is very important. Today we're going to be discussing healthcare, health insurance, Obamacare, and what we actually should do, what we should be doing to get it to a point that we can all have a system that makes sense to us all. So again, give us a call. Again, if you're watching on Facebook, do remember that you can actually talk to us by typing in your information, giving me whatever questions you want to ask, or whatever you want to add to the show. Just place it in under the show. I'll read it on air. If you want to give your name as well, I'll go ahead and do that. Now, also remember that this is a call-in show. You can call us here at 646-929-2495. Again, if you want to be on air, 646-929-2495. Right now, all lines are open. I say all lines are open, but the reality is we have an unlimited number of lines that we can actually put here. What I'm going to do as well is inside of the comment section as we speak, I'm going to go ahead and put that number, 646-929-2495. Again, that number is 646-929-2495. 646-929-2495. Well, folks, how are you doing today? Happy Saturday. Thank you very much for giving me this time. Thank you very much for discussing serious issues, because as you know, we hear the same loop over and over and over again on network TV. What we try to do here is not only talk to you or I don't want to say preach to you, but talk to you about what's going on, but also talk about solutions to the problem. Right now, there's very little of that. Everybody does a whole lot of talking. Nobody talks about what can be done. This was an interesting week. And you know what? Let me simply start by giving you the prologue of the show today. The title of the show today is Let's Understand Our Healthcare System and Force It to Restructure. And the reason I said that is specifically because I don't think the average American citizen really understand what's going on with our healthcare system. And as you know, it has multiple parts. We have the delivery of services through doctors, hospitals, etc. We have the payment of services through insurance company, Medicare, Medicaid, and these different types of systems. And we also have the drug companies who provide all the resources. And when I say drug companies, I'm not only talking about drug companies, I'm talking about the companies who make prostheses and these other things used within the medical industry. There's a plethora of parts to this equation. And what they would have you believe is that this is complicated stuff, right? This is complicated stuff you don't understand. The only thing we want the average American citizen to do is pay out of their, as Trump would say, out of their whatever. Imagine I just quoted Trump. But we have to get away from that. We have to first understand how the system works and what we can actually do to make it a better system. Because right now it is failing. Right now it's failing because it's extractive. Right now it's failing because the Our system depends on using your body, your health care as a profit center. They make money off of you being sick, but it's worse. They make money off of ensuring that you're sick, whether you're sick or not. That's where all those tests come in. But anyhow, this week, several things occurred that dictates that our entire healthcare system is revamped. To be more specific, it needs to be completely restructured. We must fight the sanity of single payer, or we must fight for the sanity of single payer Medicare-for-all healthcare system. This week, the immoral price increases of pharmaceutical drugs were again on full display. This time, it was not the crass CEO of Turing Pharmaceuticals, Martin Shkreli. It was Mylan CEO Heather Bresch who raised the price of the EpiPen fivefold, if not more. Actually, it's more than fivefold. Of course, there is also the story of AETNA withdrawing from several exchanges despite the Obama administration, an extortive act. I could go on and on, but let's talk about that today, and let's detail steps that we must take. I want to discuss several blogs that I wrote this week. One specifically called "The Explosion in Pregnancy-Related Deaths in Texas, a Result of Conservative Policies." Second one, "New analysis shows consumers will still have affordable health coverage options next year." And lastly, "Medicaid expansion lowers marketplace premiums by 7%. Do those sound kind of disjointed? The reality is the medical system is one. These are not disjointed. They would have you believe that they are. What are your thoughts? Let's talk. I also will be following our hashtag Politics Done Right on Twitter. And also my Twitter address is Egberto Willies. Give me a call. Again, that number is 646-929-2495. Again, that number is 646-929-2495. If you're here listening on Facebook, you can type into the space if you want to add something to the discussion, if you want to ask a question. And likewise, if you want to watch, you can also call with from Skype or wherever to that number that I just gave you and add to the discussion. I hope to hear from you. What are your thoughts? Let's talk. I will also be following. Of course, we're here on Facebook Live as well. Facebook.com/Politics Done Right. Go ahead and go to Facebook.com/Politics Done Right and give us a like. Let's make sure that this show gets placed all over the place. But, you know, folks, you know what time it is. And anytime I say, you know what time it is, I have to put out this little thing that I do here. And it goes like this.
It's time for the weekly blog post.
This particular blog post is actually pretty darn short because it references another one another blog post that I wrote, that I pretty much gave the information of what occurred here. Texas is now, the name of the blog, "Pregnancy-Related Deaths Explode in Texas After Explosion in Pregnancy-Related Death in Texas, a Result of Conservative Policies." Texas is now paying the price for electing politicians who place ideology over human life. The skyrocketing pregnancy-related deaths are the outcome. In other words, folks, our policies, not our policies, but the policies of the Texas legislature run by conservative right-wing Republicans who cut services to many of our fellow Texas citizens, to many, and by the way, I know this show is listened to all over the country, so it's not only, this doesn't only occur in Texas, this has also occurred in Kansas and several other places. But anyhow, VBUR 90 reported the following. Texas had the highest or nearly highest uninsured rate in the country during this period between 2010 and 2012, as Texas was closing some women's health clinics. The mortality rate in that state doubled. Our state, Texas, doubled. Study authors say the spike is still hard to explain, but some other birth experts say possible connection is troubling. It drives me crazy when you have good empirical data and the study authors, and you know why they do this. They don't want to jump the gun, but they still do it in a fashion that's concerning. Study authors say the spike is still hard to explain. Come on, really? It wasn't hard to explain, and we'll discuss that a little bit further. But the Huffington Post writes as follows. It writes that the rise coincided with the states slashing healthcare funding for women by substantial margins. I know it's not always, you cannot always equate things happening at similar times to being absolutely what's causal. In other words, not because the Texas cut healthcare, that does it mean that the death of women suddenly exploded. It's caused that. But what caused these guys to, let's see, the comments should be turned, no, the live feed should have the comments on I'm speaking to somebody who's talking over Skype here. No, the comments should be on. You should be able to go into our system and send comments to Politics Done Right. I don't even know that I have the ability to turn that off. So no, you should be able to, if you have some questions in Politics Done Right, just like I just entered a little piece, you should be able to click on comments and send me any information you want to send. But yes, folks, while it's not necessarily causal, it is, the signs are definitely on the wall. Anyway, the Huffington Post writes that the rise coincides with the state slashing healthcare funding for women by substantial margins. Women health advocates blame a Republican-led state legislature that gutted Texas families planning fund by 2/3. 73.6 million out of 111.5 million was cut in 2011. Against this is what Texas did. They cut 73.6 million out of 111 million budget. Think about that, folks. Think about the draconian, immoral, evil nature of a government cutting that kind of health care for the people who least can afford health care, and wondering, why are our women now dying? The legislature forced the shuttering of 80 clinics that provided birth control, cancer screening, and other services. The state of Texas created or committed legalized murder. Think about that, my friends. Think about that. Absent cutting a budget, giving people the health care the taxpayers justifiably paid for, our Texas women, many of them, are now dead. Last week I made some mention about pro-life versus pro-choice versus anti-choice. I got into that discussion. Why did I get into that discussion? I got into that discussion because I constantly tell folks, many people who love to claim morality, many people who love to claim they care about life, they care about the living, would do something that we knew would create what got or what occurred. Easily, we have Texas seeming to be now a third world country or worse, based on its birth, based on the death of mothers conceiving children. Is that not anti-women policies? Aren't those anti-life policies? Think about it. Now, let's go into an alternate reality. Let's go into an alternate reality knowing how the right wing normally discusses issues related to progressives, related to liberals. If such an eventuality had occurred, think about this. If we had a report that came out that said, due to more than likely due to policies effected by this type of government, we had all these dead people. Don't you think the right wing, the radio shows, and everybody else would be on air screaming bloody murder that progressive policies has caused the death of many of our women. Yet, progressives with shows, progressives on MSNBC, progressives on CNN, progressives everywhere. Who is actually making this an issue? And we wonder why it is that America has a bias sometimes toward somewhat right thinking in certain issues, because their belief is that the policies that are affected by progressives or if are affected by the right somehow maybe aren't as bad as they are. Again, for those listening live and those who will be listening on the podcast and those who would be listening on the vlogcast on live on Facebook Live, please keep this in your head. Please keep this in your head. Right-wing policies has affected the murder of many of our citizens in this country. Not only Texas, where we have the empirical evidence that it has occurred. Several women that otherwise would have been alive are now dead. And we have the actual evidence in Kansas where their government is falling apart. Think about that. Think about that. It is important. Now, this week, something quite interesting happened, right? Everybody raised a whole lot of hell about Mylan and the CEO, Mrs. Bresch, I think is her name, Miss Bresch, Miss something Bresch, the CEO. And by the way, she is the daughter of a prominent Democratic senator who decided to raise the price of the EpiPen over fivefold. Now, how is that possible? Well, because it's a free market and they can do as they please. Because it's a free market and they can act and do as they please. But when you get sick, you don't have that option of saying, well, I think I am going to have choices to make. No, you get sick, you go to an emergency room, they take care of you. You can't say, well, how much is that aspirin? How much is that defibrillator? How much is a saline solution? They give you what they think they need to give you for you to stay alive. But because it's a for-profit system, they don't only give you what they need to do to keep you alive. They give you what they need to give you to maximize the amount of monies they have to collect or they can collect from the insurance companies. And now that we have Obamacare that is trying to put some restrictions on the thievery, there's a new thing that they do. And that is, it's not a new thing, but what they do is they overprescribe, they overanalyze, they overdo all these things. Why? Because it's profit centers. Healthcare should not be for profit. So before I go in further, I want to give you my healthcare stint, because I called the insurance company the evil within healthcare. But it's not only the insurance companies, right? It is also the drug companies. It is also the manufacturer of prosthesis, etc., etc. Why? Because they have the unlimited ability. And by the way, hi Kevin Higgins, hi Marianne Richards Castiglia. Welcome aboard. And again, if anybody else wants to add some commentary to the show, please make sure to put it in our, go ahead and put it on our Facebook Live. Or again, you can give us a call at 646-929-2495. Again, that number is 646-929-2495. But we have a very corrupt healthcare system, an immoral healthcare system, a healthcare system that really demands change. But the problem that why we haven't had a revolt yet is twofold. One, our healthcare system, the payments of a lot within our healthcare system is hidden behind the facade of insurance, an unnecessary entity. And we have the monopolization of our drugs, prosthesis manufacturers. And of course, the least worst folk within the system are doctors. I really believe, my sister is a doctor. I believe most doctors are kind, most doctors are moral, most doctors want to do good. Most doctors want to do good. But then we also have the hospital system. So we have doctors, sort of the good folks, except for the big ones, trying to do good. Note that the UK NHS has incidents built in the DRS to do more efficient preventative. You're absolutely right, and I did quite a bit of study of the NHS. They give a whole lot of trouble about it. Notice what the right is trying to do with the NHS, however. The right is trying to defund the NHS as much as possible, but that's another subject. NHS, by the way, is a national health system in the UK, which is very good, but a bit less efficient. Now, we also have the system in Canada, and on the blog post I also gave there's some distinctions between these different types of healthcare. There is there is really single payer. There's also very controlled insurance, where you have controlled insurance, and then you have the policies where everybody's on their own. But anyhow, let's get back to the topic as I was trying to discuss it. And if anybody wants to call and add, just do as our callers or our viewers right now are doing on Facebook, and give me the information that you want me to put out there, the questions that you want to ask. And yes, Madiam, Florida governor refused Medicare expansion to Obamacare, and it is killing folk. And it's more than that. I want to talk about that a little bit later, because not having the Medicare expansion to Obamacare also affects those of us who are using regular insurance or Obamacare regular insurance, not the Medicaid, but regular insurance. But anyhow, so we have these four parts of insurance, right? Manufacture of drugs and prosthesis, etc. We have the insurance companies. We have the hospitals, meaning the people where you have your beds and all that sort of stuff. And then you have the doctors. The reality is, in a sensible system, where we all realize that everyone gets sick. Everybody has the ability to get sick. More than likely, everyone would be sick, even if it means just about before they die, they will be sick. So when in the past, Bernie Sanders and many others have spoken about healthcare being a right, because everyone gets sick and because this is something that occurs to us all, it should really be considered a right. And just like education, which needs to happen to us all, is considered a right in our country now, where our government pays for primary and secondary education, so should we all collectively pay for healthcare. We shouldn't have different, only healthcare if you can afford to pay for it. Handling sickness should be collective. After all, if I get a cold, not having insurance, I can spread it to somebody with or without insurance. Or if I have insurance, I can infect somebody that doesn't have insurance. Then, from an insurance point of view, should that person who infected me be responsible with their insurance to take care of me, someone, let's say, who would not have had insurance? The complications of having an insurance-based system borders on stupidity. It shouldn't be that way at all. Anyhow, we have the system that I spoke about, 4 different pieces. Hospitals, drug companies, prosthesis companies, and insurance companies, and doctors. Look, here is the deal. Most drugs, and I wrote about all of these in several blogs this week, most drugs are paid for. Do not believe the hype. Most drugs are developed with research paid for by the United States government. In other words, you pay for most drugs that are developed in this country. When it has turned into a drug that has feasibility, it generally goes to a private company, because they know that's where they can actually hose you. It goes to a private company where they do a whole lot of testing, they do a whole lot of marketing, and then they present that drug to you, and you go ahead and you take that drug and you pay umpteens of dollars again for that drug. Why do I say again? Because you pay to develop that drug. Most of the drug companies are lying to you. The EpiPen, the drug that is in the EpiPen, was developed by the United States government, or was developed for the United States government, paid for by the United States government. The EpiPen was developed and designed by the United States government, of which now, when sold to Merck and then sold off to Mylan, is now being charged an exorbitant amount of money to you. Most Americans don't know that. They think, oh, well, if we go ahead and not allow these drug people to increase these prices, that somehow we won't have good drugs in the pipeline. It's a lie. All good drugs in the pipeline, or the vast majority of drugs in the pipeline, come from universities. They come from think tanks. They come from these other, not think tanks, but they come from research areas paid for by us, the government. When Miss Bresch was interviewed, the woman who exploded the price of the EpiPen was on. She said, we spent hundreds of millions of dollars in developing this particular product. It's a lie. She came on TV and lied. Your government, several decades ago, designed the EpiPen, okay? And now there's one company and its shareholders and its CEOs who are making a killing off of taking the money from the American citizens through to her. Now, here's what she said. She said, well, we have the EpiPen, and if we don't charge the EpiPen, somehow we would stop development. But not only that, we want to have it in every school. We're passing laws to have it in restaurants. In other words, she is using the government system to expand the reach of this private company for a drug developed by you, the American citizen. And then she's going to host you for it. Now, she also made a complaint. Don't blame the drug companies. Please don't blame the drug companies. I mean, you know why? Because the problem is that the insurance companies increase their deductible, which now allows people to see what the drug is really costing you. In the past, the drug didn't cost you. It costed a lot as well, but it was hidden from you because the insurance company was covering it. But it really wasn't hidden from you, people. You were paying for it. How were you paying for it? Because you pay for the insurance that's paying for it. You're paying the inflated cost of insurance. When I am paying $800 a month for my insurance, actually more like $900 a month for my wife's and myself's insurance, we are paying for these guys' big salaries. We are paying for these drugs that were already paid for by the United States government. So what we have to extend and what we have to get to the people in our country, what we have to tell everybody is that, folks, they're lying to you. We, the taxpayer, have taken up most of the bills for these drugs. And then the lobbyists of these companies have allowed the government to then take these drugs and make a pilfering off of it, or make a killing off of it on our dime. On our dime. These corporations are lying to you. Yes, they are evil. She wanted to come onto the TV and said, no, we are not the bad people you think we are. We're just in a bad system. We're in a bad system created by bad people. Created by people who have no morals. They don't care about humanity. We have to tell the truth. So therefore, that is the drug side. That the evil drug side. They don't do much. The drug companies do not do much. You, the taxpayer, you are the one that's doing much when you pay taxes that go to the NIST, the National Science Foundation and the National Institute of Science. You are the one who pay the taxes that give grants to universities and everything else that develop these things. Okay, please do remember that. Now, she made another comment. Oh, and thank you for saying that, Jason. Same company ships them to Canada. You're correct. Let me give you an interesting thing, okay? The EpiPen doesn't cost what it costs here in the States and other countries. So when she was confronted with that reality, she had an interesting response. She said, Yes, but the United States is subsidizing the rest of the world. I think it's a good thing that the United States subsidizes the rest of the world. In other words, yes, our taxpayers can subsidize France and England and Canada. No, they're not subsidizing a damn thing. They're not subsidizing anything. Canada, Great Britain, New Zealand, Pakistan, not Pakistan, but and all these companies with socialized medicine, all these countries with single-payer Medicare-for-all type systems, they decided that they were going to protect their citizens. These people decided they will be what a government should be. Now, this is what we as American citizens must demand of our government. We finally must tell our government, but before we can demand it, we have to know it. You see, what happens here in the United States of America is we have the news media, we have TV that lies to you ad nauseum. They lie to you. They tell you, oh, you need this drug. They tell you, oh, the prices for this drug is too high or is high because that's how we get innovation. It's a lie. The innovation comes from you. For those coming in again, the reason I repeat myself several times is because we have people that scroll in and scroll out. Folks, you are the manufacturers of the drugs. You are the ones who designed the drugs. You are the ones who paid for the drugs. Most of them, when they reach to the point of development, that's when the private sector gets it and make a killing and pilfer you. Now, hospitals. Again, another private entity. If you own a hospital, what is your responsibility if you need to maximize profits for your shareholders? Think about it. If you have to maximize the profits for your shareholders, your goal is to keep every bed in that hospital filled. Your goal is to prescribe as much as you can, period. Your goal is to maximize the use of all those pieces of expensive equipment that you have. How can you not have an incentive in a for-profit hospital to tell folks that they're sicker than they really are? Let's use our heads. Now, one of the things when I speak about you cannot look at healthcare as a market, as a free market, is because the patient has no options. The patient is by design ignorant, because by design he's not a heart surgeon or anything like that. And when I go buy a car, it is okay for them to inflate the price of a car because I can decide to have it or not. When I go buy a bike, it is okay for them to inflate the cost because I can buy it or not. When I go buy food, certain types of food, it is okay to inflate it because I neither have to buy it or not. But when it comes to healthcare, it is immoral, folks, to have this being a profit-based entity. Because in a capitalist system like ours, the goal of the capitalists is to maximize the profits of their shareholders. And they claim in doing so, capitalism is the efficient allocation of the best and most efficient allocation of resource, promotes the best and efficient allocation of resources. However, if we're treating you for things you don't have, if we're giving you drugs for for a condition you don't have, if we're busting your molar open, if we're giving you a root canal, if you notice you go to a dentist these days, every time you have a cavity, the cavity is too big to fill now because they want to give you a crown. Why do they want to give you a crown? Because if you have a crown, you're talking $8,000 or several $1,000s for a crown, or several crowns, several $1,000s. So they make more money. And if you have insurance, it's even better because if you notice the price of the crown costs more. I told folks about my high blood pressure scare a few months ago. I went to a private, super private emergency room, got charged $5,000 for under 2 hours worth of service. In other words, all they gave me was a $1 pill, and they just about forced me to do a head scan. $5,000. They sent it to the insurance companies because I have a $6,000 deductible. Of course, that belongs to me. I call them up and say, hey guys, how can you charge me $5,000 for this? They say, okay, can you give us $2,500? Well, that's better than $5,000. So I said in a hurry, oh, guess I better give that to you because I don't want that going on my credit that says I owe you $5,000. Okay, you extorted the money from me, but that's what our medical system is, an extortion machine. An extortion machine. So folks, that's the for-profit hospital. They must, and I'm coming to your next I see you, John. I'm coming to you next. An extortive hospital. So we have the drug company that has all rights to maximize their profits. Okay? We have the hospitals who are responsible for keeping their beds filled. And now we have the insurance companies, right? The insurance companies pays the bills. They buy the drugs. They buy the drugs that was prescribed by the doctors. They also go ahead and they pay the hospital bill. And to which I say, why the hell do we need the insurance companies to pay a bill? Why do we need to pay 33% of a dollar to pay a bill? In other words, the insurance company is collecting all this money from all of us, and it costs them 33% on average in the past. Now they have to end it at 20%. But there's some trickery in there, right? Because regular expenses are not considered within some of these, within that 20%. There are certain expenses that are not in there. But anyway, why should it cost you 20% to pay a bill? Because you have a CEO, a CFO for several different insurance companies that so-called are competing, because they have to have an advertising budget, because they have to have all these different budgets, right? That if you had one payer, you would have none. If it weren't for profit, you don't even need to advertise, because guess what? Your medical care would be covered out of general revenue. And for those who said that will increase our taxes, yes, it will, but it will decrease your premiums. And in general, you will be out ahead. The poor will be out ahead. Everyone would be out ahead. The only sufferers are the destruction of the insurance industrial complex, the destruction of much of the people who are just passively taking your money away. Let me bring John into the discussion. John may have some problems with some of what I'm saying with the single pair, but come on in, John. You're here. How are you doing today, sir?
Good afternoon, Egberto. How you doing?
So far, so good, sir.
Okay, I just want to talk about the Colorado care, which is actually something that
it's coming up.
Yes, on the ballot.
Yes,
Amendment 69 in Colorado.
Yes.
Okay, so this is a healthcare payment system designed to finance universal healthcare for Colorado residents, partly through an additional 10% income tax.
Yes.
2/3 paid by employers and 1/3 paid by employees for payroll income, providing approximately $25 billion per year in revenue.
Mm-hmm.
Do you think that this is a good system? Well, I mean, I know you've been kind of skeptical about having employers pay, but in trying to take away the link between healthcare and employers, I guess.
Let me answer your first question, and then instead of giving me several questions, but here's what I think. I think that is a compromise, right? That is to prevent a shock, right? Because what happens here is this. The employer pays you knowing that they are responsible for your health care. Now, if the employer were going to give you immediately, as soon as this, let's assume that the law that they passed in Colorado said the following. Immediately, everybody responsible for their own health care, and it's also progressive. In other words, based on what you can pay. And let's say immediately thereafter, because that would be a big break for companies, they gave that money immediately to employees. It would make sense, right? For me, it would then be, I would want to be the absolutist that I am with respect to taking healthcare insurance away from the employer. I don't want the employer to have anything to do with our healthcare system. I think it's a sector that they don't need to do. But because realistically speaking, and you and I will talk about what is politically, what you can do politically and what you cannot. I think it's a first step that we get a single payer entity and the payment goes from employer to, both participating employer and employee for the insurance policy, because it really hasn't changed anything, right? What it has done is the following. Right now, if you work for somebody, they pay a portion of your health care and you pay a portion. Because when somebody comes to me and say, oh, I work for 4 hours space and I'm paying $200 a month for health care, that policy is really costing them $12,000 a year so it's subsidized by the company. It's pretty much the same thing, and that's a palatable compromise. My hope would be that as time goes on, we skew it. In other words, as time goes on, the employer is responsible for less and the employee is responsible for more. And when I say the employee is responsible for more, I mean the average citizen is responsible for more in a progressive manner. We need to decouple healthcare from business. That will make business flourish. Why? Because my business, I can do my books based on reality-based planning, not based on if some of my employees are sicker than the others or things like that. I no longer have to worry about things like that. So I think it's a good compromise, John, for now, to start with.
Okay, no, I agree. I think it is also. I guess but when you say that, I mean, you look at Medicare and a lot of the people who are promoting single payer,
right?
Talk about, I mean, Medicare is essentially, a system where it's a 50-50 split.
Right.
This system, which most progressives say should be the idea, is also, still dealing with 50%. But I mean, I guess that's in addition to the actual insurance. You know
right.
what I'm saying? Because I mean, if you're 18 years old, the employer and yourself are paying into this.
Right.
But I mean, you still need separate insurance. And so what Colorado Care is doing is essentially putting this all together.
Yes.
And if you can't afford this or you don't have a job, you will still get, have, coverage through Colorado Care.
Right.
So, I think it's...
I'm sorry, go ahead, John.
I think it's good. I think it's good also, as a first step. I mean, eventually, my idea is to have, nationalization.
Right.
I think that actually does the best, covers the most people, and is the most efficient way of doing that. Now, a lot of countries in Europe don't have that. I mean, they just have a similar system to what we have, which is a single payer system, but it's still essentially taken through the employer.
Right.
And so yeah. I mean, I also think that 100% should be covered through Medicare.
Exactly.
Right now at 80%, that's good, but I mean, you still have to have a supplemental because, let's say you have a heart attack,
right.
Or some serious injury to where, let's say you have $100,000 bill, which happens all the time. Mm-hmm. I mean, can you really pay $20,000?
Oh no, you will never.
People can.
No, even today you won't pay $20,000 because there's a cap. The cap instituted by Obamacare applies everywhere, and that is $6,100 per person. So I think it's $6,100 per person. So that's not the cap. Let me do tell you one thing, however. I think. And this is where the realist in me come out, right? And I had to kind of learn this in watching people's behavior, human behavior. There are some people, and we don't know how many, that are hypochondriacs, and that once you have just free healthcare where you just walk in and get healthcare, that it's all paid for, that they get a mosquito bite, they're in there. So the realist in me says this. I want some sort of a buy-in from me. I want some sort of a buy-in from you. In other words, there are certain basics that we do for healthcare in our country. We give the colonoscopies, we give the preventative care and so forth free of charge. Now, and we have good coverage. But that anytime you see a doctor, let something come out of you, because if something is going to come out of you, you're probably going to say, do I really need to spend this $10 or this $20 or whatever we agree upon? I don't know what that number is. Of course, there are people who don't have anything at all, and we'll have to write the laws in a manner that mitigates for that. But we also have to be, I think, cognizant that there is room for abuse, even if the abuse is not malicious, and that is what we want to judge for. So I'm a true left-wing liberal progressive, but I also believe in some of the things that conservatives talk about, where you have to have some sort of controls in there to prevent, the abuse of these particular, services. But I want healthcare paid out of general funds, period. I don't look. The only reason insurance companies do these things called risk management is to maximize profits, right? The only reason you need risk management is so that you can control how much profit you can make, or to control that you don't lose all of your profits. Now, if you look at risk management for an entire country, where an entire country is covered, you're starting to then look at the risk of the entire country. There are some interesting things that come out of something like that, right? If you're looking at the risk of the entire country and you want to reduce your budget, then you may start passing laws or having programs that say, well, as a country, let's try to teach our kids to consume less sugar. As a country, let's try to teach our folks not to eat as much fat. When we have a national scope of what health looks like, the risk management of the country's health, as opposed to cherry picking different groups of people, bastardizing the healthcare system, there are some benefits that can come to this. Of course, all of this require good, great management, but we've so demonized government to believe that, government does bad. No, government doesn't do bad. Politicians make government do bad. I know too many darn people in government who want to do good work, who really want to do good work. So we have to get away from that type of that paradigm. John, stay with me. I want to bring in 620. 620, who do I have the honor of speaking with?
Oh, this is Jack Goldie.
Hey, Jack, haven't heard from you in a while. How you doing, sir?
Fine, I had difficulty dialing this. You were spewing for about 30 minutes.
No problem at all, sir. Why don't you tell me what you want to call about? Tell me what you want to talk about.
What I want to say, I agree with you 100%. I'm in the hospital right now.
Oh, are you okay, my friend?
Yeah, well, I'm getting a heart transplant.
Wow.
Yeah. Supposedly paid for by Medicare, and I'm in Kansas.
Well, the good thing about Jack, hold on. The good thing about having Medicare in Kansas is you're completely disjointed from your government, because your government, Kansas, is lousy. And had you been on some policy within your government of Kansas, meaning the insurance within Kansas, you had been screwed, but you're okay. Go ahead.
Yeah, well, I believe, the whole darn thing, way back in the 70s, okay, 20 years ago, I took a course in business administration.
Right.
I think it was a profitability in maximization of profits. That's what gets there.
Right. Right. Well, I mean, that is by design, Jack. Look, we live in a capitalist country. I have nothing against capitalism if it's used as a tool. I have everything against capitalism if it's used as an ideology. Right now in America, capitalism has become an ideology.
Ideology.
Right.
Well, that's the first step. I don't know about if the laws were enforced.
Yes.
I can't believe I am getting a heart transplant.
Right. Well, I tell you what, Jack, it's great. First of all, I hope that you get well and get well soon. You've been a caller for a very long time, and you are a very strong man. So congratulations on getting your
Well, I'm 85 years old.
Right.
My 85th birthday, let's see, how long ago was it? In June.
Right.
June 2nd, 85.
Right.
That's the age they say it's a maximum.
I understand.
What the hell?
I know, Jack, let me tell you this. I understand because of your age, a lot of folks would not want to do the transplant. However, it should always be based on whether you have the ability and your longevity. And having spoken to you for a very long time, you're a very strong man. So I mean, I need to run to Mr. Ledoux right now. Daniel Ledoux asked an important question. He asked, "Can you explain?" And this falls into this healthcare narrative that we're talking about. His question is a very important question, and it says as follows: "Can you explain capitalism as an ideology as opposed to just a tool?" Okay, capitalism as a tool says the following. I want to build something. I want to create some product. I am going to go into the capital markets and try to raise funds to create this product that we want to build. I am going to, I may even form a corporation around this product that I'm going to build. It works very well for things like that. Building a car. It works very well for building homes, building subdivisions. In fact, in the past, during the founding of this country, and I'm going to be going to New Mexico to talk about this with Move to Amend shortly. Corporations were only formed for a limited amount of time to create a project or to do a project or to build something. And after that, it was dissolved. They didn't get a public entity that had the rights of, that got all these legal rights, were intended to create something, do something. And when that do and creation was over a certain period of time, it dissolved, and everything, because it was public in the first place, went into the public domain. But we decided, because out of greed, we were going to make it not, in order for us to get away from having it being that way, we had to make it an ideology, something that comes from within, something that was our innermost purpose, something that we as Americans were, a capitalist country who praised capitalism and the market. The reality is there's no market. Market is a figment of the imagination of those who decide to indoctrinate you into believing that this invisible thing called the market is your God. What do I mean by that? Well, let's see what the market dictates. Right here in this country, we have a whole lot of work that needs to be done. Streets need to be built. Everything needs to get done. We have a whole lot of unemployed people. But somehow we cannot connect the two. Why is that again? Oh, there's no money. False. We have fiat money. Study there's a concept known, or there's a theory known as modern monetary theory. You would see that if we really wanted to build things without, and it doesn't have to be inflationary. Read some of some very important economist things on this, where we could create money to do these things, and it cost. We create jobs. People work for the money they get. People are able to spend the money that they get, but it's built on not capitalism. It's built on reality. Now let's go back to you're right, Ledoux. Money is an illusion, and that's the reason why the fact that capitalism as we practice it is unable to connect workers and jobs proves to you that it is being taken advantage of. In other words, we are trying to keep a particular sect in power by not accepting that money is an illusion, and if we need to expand it to create prosperity for the people, we can't, because most people don't want a prosperous, intelligent mass. What they want is an indoctrinated place where few will be served by the masses. Now, there are certain things, like I said, I support capitalism to do what capitalism does. Actually, I'm a software developer, or I'm still a software developer, but I'm doing mostly political activism. But the reality is as follows. What can you do? Let's have capitalism do what capitalism does best. And let's have socialism do what socialism does best. Treating people in the hospital. Okay? We'll talk about individual freedom a bit after this, Ledoux, because individual freedom is something that's used to actually indoctrinate folks into making bad decisions as well. But let's first talk about how capitalism should be used. Use capitalism to build your cars. Use capitalism to build new products that are not necessarily essential. Use socialism to build social things that humanity needs. Healthcare for all. Everybody should be covered by healthcare. Basic services. A basic living wage. what they call, I think in some place, I don't remember what they call it, but just where everybody gets a minimum sustenance. And then we start to fund our schools so that people are taught civic. What does it take? What does it mean for me to be a real American? Somebody that gets up in the morning and go to school, or somebody that gets up in the morning and go to work? Let's teach people what our ideology as Americans are. People that are productive, people that go to work. If people have that ideology, that indoctrination's in their mind, we don't have to worry about the guy standing up on the street corner, but our system creates the guy standing up on the street corner. Our system creates the lazy people because it creates distortions within the economic modality. Now, as far as individual freedom, we never had individual freedom, and we can never have individual freedom in a society. So those people who go out there and always talk about, I want to maintain my rights to do X, Y, Z. Maintaining your rights may depend on harming my rights. So we have to come to some sort of an agreement. There is no individual absolute freedom. There's a freedom of society. We have some gradation of freedom. I don't want absolute freedom. Never. I don't want absolute freedom. I want the freedom to do most things. I want the freedom to have my own company. I want the freedom to have my own wife. I want the freedom for all these things. But there are certain things where my freedom can infringe on others. If I don't want folks smoking around me, that's one thing, but I can't stop them from smoking. That's an individual freedom. In as much as it damages people, I think you should have. So we are just cogs in the machine. Yes, we are just cogs in a machine. And you know why we are cogs in a machine? Because never were we ever individual. Never could we ever exist alone. If any man could exist alone, then we wouldn't be a cog in a system. But none of us can exist alone. If you think, and in fact, those of us in this country that make the most are generally the least able to survive under some individualistic mantra. So Ayn Rand, even Ayn Rand, when she was on her deathbed, was on Social Security and social services. So most people who talks about this individual liberty can never abide by the tenets of individual liberty because they need us all. Bill Gates, the richest man in the world, couldn't last a day with all of his servants. Free association, of course, I believe in free associations. You can associate with whoever you want. That comes from our Facebook Live. I believe you should be able to associate with anybody that you want to associate with. Absolutely. No problem at all. But again, we cannot let these buzzwords, we cannot let these theories come into play where humanity really comes into being. And as a humanist myself, and that is the quasi-religion I choose for myself, a humanist, because I believe the people who can make a difference, the people who will make a change are humans. Now, I said at the beginning of this program, I wanted to say, what do we do to solve the healthcare problem? I want to get back on healthcare. And it's simple. I'm glad that John brought up the Colorado. We're Colorado. John, what is the Colorado bill again?
I believe it's Amendment 69.
Right.
I think I closed the window. Let's see. Let me just make, Amendment 69. That's right.
Now, Colorado is...
Right.
Go ahead, sir.
Yeah, I mean, it's, just looking at most of the Democratic politicians, that are in power are against it. You got 3,600,000
right.
by all the corporations against it. You have, I think 300,000 for it. Or 662,000.
Right.
So, this is just typical.
In corporatocracy at rate.
It's very hard, but it could win still.
And I think it's going to win, but it's going to win. I have friends with Move to Amend who are working on it. But anyway, we're coming to the end of the show. So here's the deal where we make the change. Just like Colorado started it one step at a time. Everyone in every state, there are these different groups that are put together trying to push our medicine, trying to push Medicare-for-all, single payer Medicare-for-all. Find them in your area. Find them. I'll post some of them on the blog for this show as well. But let's start working with these organizations who are attempting to create a single payer healthcare system. Most importantly, let's educate our friends and neighbors and families. They're not stupid. They're just ill-informed. Let's do what's our job. Let's be the kind of people that we must be. Let's show them. Let's teach them. Let's show them in a very non-threatening manner the light that they need to see, that the only way we are going to solve our problems is solving our problems together in a manner that can actually work, that can actually make you, not only yourself, a better person, but society a better society, a society worth living in. Don't follow the crazies on the right. And that, yes, I did have to say that they have no solutions to problems that really helps humanity. Let's start thinking more as human beings. My name is Egberto Willies. This is Politics Done Right. I'll see you on Thursday at 3 p.m. on KPFT 90.1 FM. C'est la vie. Adios. Bye-bye. My Facebook friends, thank you very much for listening. Please do me one favor. Please make sure that we share these types of programs. Not only mine, but there are other folks that are doing these types of programs. It is very important that we know that, as John mentioned earlier, the mainstream media is not going to keep people informed as far as how healthcare really works. I try to do some here. I will continue to try to do some. I think it would be a lot more effective if I get a whole lot of questions asking us about how can we do this? How can we solve this? But please share these types of programs. It is extremely important that we become the media, because the media is corporate owned and their goal is in fact to misinform the citizen so that we maintain the status quo. It's not that they're bad people. It is just that they are simply following the status quo. Thank you very much, Liz Lane, for having been here. Thank you, Daniel Ledoux. Thank you, Kevin. Thank you, Emily. Thank you, Jason. Thank you, Marianne Castiglia. Thank you, everybody, for showing up. But again, very important, please share these programs. It is very important. I am now checking out of Facebook Live. Thank you for being here. Arrivederci, tenga buen día a todos mis amigos. Welcome to Politics Done Right. I am your host, Egberto Willies. This is the progressive program that will take the mystery out of politics. This is the program that will encourage you to make sure government becomes we the people. Whether you are liberal, conservative, or otherwise, you get to air your point of view. Remember, you can also send me a tweet to EGBERTOWILLIES. That is, at Egberto Willies. Let us engage. It is politics done right.
1, 2, 3, 4.